You're taking care of a patient, they're tachycardic, their blood pressure is rising, they're shaky and have a tremor, they're confused, they're hallucinating, they're really clumsy and ataxic, they're throwing up, they feel miserable. And oh, yeah, they're usually a heavy alcohol consumer and they haven't had a drink in the last 36 hours. It's pretty obvious this patient is going through alcohol withdrawal. But let's talk about why these patients have those set of symptoms. So in our brain, we have a balance of neurotransmitters. We have inhibitory neurotransmitters. The main one is GABA. And when GABA binds to those GABA receptors, it causes a inhibitory or a chillaxed effect. And when you drink alcohol, alcohol also binds to those GABA receptors. And so it gives you inhibitory effects. So it slows you down. It inhibits the things that your body does. Now, those inhibitory neurotransmitters balance with excitatory neurotransmitters, things like glutamate, acetylcholine, epinephrine, and norepinephrine. Those are your go, let's do it, let's crank it up neurotransmitters. And in a normal, healthy brain, we have a balance of some gas, but also some brakes. And that creates a normal, healthy, functioning individual. Now, in our patients with chronic alcohol use, they have those excitatory neurotransmitters, but because alcohol starts binding to those GABA receptors, they have the inhibitory effects brought on by alcohol, but because they have those effects and it's not being induced by the GABA, the brain starts to sleep on GABA production. And it says, we don't need to make that anymore because we're having the effects from somewhere else. It's the alcohol. So let's say a patient stops drinking. That alcohol was providing those GABA effects. And so all they have left in their brain, they are all gas and no brakes. And so the autonomic nervous system starts going crazy. And remember, the autonomic, that controls the automatic things that you can't control. Your heart rate, your blood pressure, your temperature. These patients start developing a tremor. And in their brain, it's massive firing, right? It's all gas, no brakes. And so their blood pressure is rising, their heart rate is going up. They're getting more anxious and confused. They might have hallucinations. They might be throwing up. So what are you going to do about it? Yeah, we usually reach for our benzodiazepines. Well, what's a benzo going to do? Guess where it binds? You guessed it, the GABA receptors. And so those GABA receptors that aren't receiving the alcohol or any endogenously produced GABA, because remember, the brain is sleeping on GABA production because the alcohol has been doing the work of the GABA on the GABA receptors. We grab a benzo and it binds to those GABA receptors to provide that inhibitory effect that these patients are craving so much until their body can sort things out and their brain can go, oh, okay, we're not going to do the alcohol for the substitute for the GABA anymore. All right, we're going to start producing our own GABA again. So there you have it, how to take care of a patient in alcohol withdrawal.